everyone, Dr. Dom here with West End Chiropractic and Wellness, and welcome to our new patient orientation, where we're going to talk about key values into maximizing our care at West End. So we dive right in and we look at chiropractic explained in a simple form. It's spinal motion is essential for spinal health and spinal quality. And then of course, a healthy spine is essential for overall health and quality of life. So that's really what we're trying to achieve, is that healthy spine for everyone. If we look at a loss of spinal motion and then just a general sedentary behavior, it's becoming a very large problem for those in the industrial world. We talk about the amount of hours that we have to sit at a desk all day, and of course that poor posture that contributes to those symptomatic factors as well. And when we look at an average person sitting 32 years of their life, that's a substantial portion of someone's overall lifespan, right? So if we break it into an analogy, sitting to your spine is like sugar to your teeth. It's a very simple analogy to understand. So sitting is becoming a very large pandemic, separate pandemic than COVID-19, of course, but it is really becoming that widespread across America in general. And of course, if we look at that loss of spinal motion, we get immediate result in muscle breakdown, so those muscle tightness, that spinal adhesions and scar tissue that don't lay down properly, and that causes inflammation in our body as well. And that significantly reduces the healthy messages from the brain to the body and start to increase stress messages in the body. And when we have a lot of stress messages, we start to mess with our body's coordination, strength, balance. And because we're having an increase in cortisol and adrenaline, we're going to see pain and discomfort that can occur with that as well. So what is this process called? This is actually called a vertebral subluxation complex, or just subluxation for short. That joint that's not maintaining its motion will start to alter our body-mind nerve message flow. So those nerves that come out of the spinal cord and housed by our spine, of course, will start to adversely affect our sensory motor areas of the brain. And that will determine how well our neuromusculoskeletal system works. And it'll also start to influence our mood, our learning ability, and hormones produced in our body. And if we start to stimulate that stress center in the brain, we get a result and a change in our autonomic state towards stress dominance. And that can lead to chronic disease and health and quality of life down the road. So we're talking about type 2 diabetes, cardiovascular disease being those chronic diseases when we have very high levels of stress in our body. So let's look at that cause and effect relationship with the subluxation. So we get that joint that's not moving, and we're going to have effects on our stress, right? So we have stress in our body, and nociception there is just pain. So you'll start to have increased pain signals, and then with the increased stress in the brain, we start to see that play out in our muscles. So that increased muscle tension, that tightness, and increased stress hormones also will then, of course, create chronic metabolic shift towards illness as well. If we look at another aspect, is that more that coordination aspect, is it'll start to play a role in our proprioception. And that is a fancy word for how our body is able to know where we are in space. So that's our balance and our coordination get decreased. And then we get decreased spinal and overall health and function because of that. And of course, when we have chronic neuromuscular, metabolic, and psychological shift towards illness as well over time. So it's really understanding that this is full picture. We've seen studies that show that the subluxation results in a loss of functional ability, and we get a decreased quality of life because you've reduced the health of your spine. And we know that that's going to reduce our health of our overall physical and psychological health as well. So this is not just about our muscles and our bones. This is really gets to that next level where we start to see the changes in our chemistry inside our body, and that mental and social aspect as well. And did you know that you can have the subluxation with or without symptoms? So the loss of healthy motion in the joints of the spine, with the muscle breakdown, inflammation, and a reduction in the altered body-brain nerve messages, they don't always cause pain. at least not right away. So over time, we do start to see that pain will increase as that loss of healthy motion increases over time. If I pop this window over here real quick. So how do we manage these subluxations? And you've already done step one. It's managing this by it's managed and corrected by programs of regular chiropractic manipulations or adjustments that are going to restore that motion in the spine. They're going to put the spine in alignment, and they're going to be able to break up scar tissue and then decrease those inflammation levels in the body as well. So chiropractic also will restore a healthy flow of that spine-related brain-body nerve messages, so our nerves can fully function throughout our body. And we've also seen that research shows very clearly that an addition of omega-3 fatty acids, so that fish oil, and vitamin D supplement, in addition with spinal fitness exercises, will provide the most evidence-based and clinically effective spinal health protocol. As discussed in your last visit, that omega-3 in combination with vitamin D product that we have is really going to decrease those inflammation levels with that omega-3 and start to increase our muscle healing and performance with that vitamin D supplement as well. And of course, immunity and a ton of other hosts of benefits with vitamin D, but those two being very crucial with our care plans here at West End. So what medical professional can effectively and safely treat these subluxations? And that is a doctor of chiropractic, of course. And we are the world's only specialist trained in detecting and correcting a vertebral subluxation complex. So really a DC or doctor of chiropractic is going to be the professional to correct those vertebral subluxations. And we have a ton of research that shows the benefits of chiropractic care. I would love for you to stop by the office and ask any of the docs here for a copy of these research articles. Pause the video and jot any one of these down that you would like further information about. We'd love to print them off and review this. This is a passion of all of us here in the office as we really follow the most up-to-date research in chiropractic care. So how long does it take to restore that motion and correct or manage the vertebral subluxation? And it's really key to understand the 3 phases or stages of healing. First being that acute inflammatory stage. So that first 72 hours, lots of inflammation, lots of pain in that area, right? After about 3 days, you start to lean into that repair stage, and that can last to 6 weeks. So if we think about healing and repairing muscle tissue, it's really that 6-week mark. Then we start to remold the tissue, the muscle remolds, the ligaments remold, which that ligament remolding in that 3 weeks to 12 months is super crucial to have the stability of the spine and stability of your overall alignment is going to be so crucial. So maintaining that spinal motion and alignment is so crucial throughout each of these stages and is a requirement to allow the tissues to heal properly and to really get proper nerve function throughout the body. So to actually answer the question of how long does it take, it really depends on 3 key factors. Really, it's how long have you had the subluxation present, and then what's the severity of degeneration that could have occurred from having sustained periods of vertebral subluxation. The second being, what's your lifestyle habits outside of the office that will determine your current and future healing potential. So if we talk about moving that arrow up, but then we sit 8 hours a day and we start to get this pushback, that's going to determine how long our progression throughout our care plans. And the last one, of course, is just a willingness to follow the doctor recommended treatment plan for you. And of course, whatever lifestyle recommendations or factors that they want to alter for you to help heal as quickly as possible, right? So those are the 3 main factors that go into how long it can take for each individual person. So we just have to remember that healing is a process. You will regain your health and function because healing takes time. So if we just understand that for some, symptoms are going to go away right away. or very quickly. For others, it's going to happen much more gradually as they start to increase. And for some, it's going to be this roller coaster up and down for a while. And then, of course, something that was mentioned after that first adjustment is sometimes your symptoms can get worse before they get better. You start to break up spinal adhesions, scar tissue, maintain motion joints that haven't had motion for a long time, as symptoms can get worse as inflammation levels increase again. So it's so crucial after that first adjustment to ice the affected area. So for everyone after that first adjustment, if there was any soreness, remember to ice 20 minutes on and 20 minutes off in that affected area to help decrease inflammation levels and decrease pain for you as well. And then pop this back down to the bottom. How long do you need to have your spine checked to maintain a proper spinal alignment and prevent those vertebral subluxation complex? So how long do we got to stay on chiropractic care, right? That very familiar question. And the overall honest answer is all of these. If you look at how long do you need to keep brushing your teeth, or how long do you need to keep exercising, or how frequent do you want to keep eating healthy or need to keep eating healthy or think positively, it's really as long as you want to be healthy. So as long as you want a healthy spine for overall health and wellness, that's as long as you need to stay on chiropractic care, truly. And then one last part that we're going to talk about tonight, and you may have gotten a chance to talk about with your doctor at that last visit as well, is this lifestyle health risk assessment. Depending on the patient and their case, this could have been recommended to you, and it's something that we offer all of our patients at West End. And this is really think about it as a chiropractic physical that you receive, so that we can see a window into wellness and prevention, and really then we can prevent illness before it even happens. So the questions the HRA will cover, that health risk assessment will cover, is your current health risk status. So it's very similar to our spinal health assessment, where we get a score of where your health risk status is going to be. And then we're going to actually get to see the exact stressors that are causing your health risk status. That will be able to give us an idea of the health resources that are required for us to recover and to be able to predict future wellness and prevention for you. And then, of course, what is your predicted health risk status, so that we can start to break down those lifestyle stressors that are contributing and give you resources to help have a better future health risk status. And then lastly, it'll cover how do regular assessments and monitor your health risk status into the future for you, as well as we check in every year with the physical to review, making sure that we don't have any deficits in any area, such as maybe somewhere we're not eating well or not moving as well or not thinking as well as we possibly could be, that can all contribute to those chronic illnesses down the road. So we always want to get ahead of those. We really want to have a full body health and wellness approach to our care. So if this was not recommended to you, bring it up with your doctor and see if this is something that could be a benefit for you. Of course, getting into more case specific topics with your provider as well. And of course, we covered a lot today. There is a lot to review with you. There's a lot more within chiropractic care, of course, all those research articles. So please, if you have any questions, ask your provider, ask any doctors at the office. I know I'm not listed there, but you can go ahead and stop me at any time, Dr. Dom. I'm willing to walk through any kind of questions that you guys may have. I'm so excited that you're starting on your spinal health journey here with us at West End Chiropractic and Wellness. And I look forward to seeing you all in the clinic very soon. Have a good day, everyone.